This is another session answering questions from Las Vegas. One of the questions is from Assad K in Madrid. It doesn't say where. I don't know if it's Madrid, Spain. I know there are a number of cities in the United States that are named Madrid. In any event, what he's saying is, please go win the election. I got to tell you, Assad, I'm trying as best I can. Now, there's a group of questions that came from Elizabeth C. in Atlanta, Georgia. And she's great. She's got at least 4 or 5 questions here. And Elizabeth, I'm going to try and answer them all, and I won't come back to you every time I do it. I'll just read the questions. And the first question you have, and without any background, is why do your fellow candidates refuse to denounce the war on drugs? Also, concerning the war on drugs, I have a question about your views. What do you mean when you say regulation of harder drugs? Does that mean that the drugs can be provided, and your question tails off for lack of space? The war on drugs is what is ravaging our inner cities. And so what I'm suggesting is that, and plus we know through studies that marijuana is not addictive, no more addictive than alcohol. And so if you can buy alcohol in a package store, you should be able to buy marijuana in a package store. However, with the harder drugs, what we need to do is to identify the people. And so if you have a cocaine habit, there's nothing wrong going to the doctor. He'll give you a prescription, and then you can turn around and go get it filled at a pharmacy. There's been experiments in the Netherlands, Denmark, and in Switzerland where they just dispense drugs like that to people, and people go on to normal lives. It's by our attitude to criminalize this that causes so much damage. And I've said, and I'll say it right now, it's the war on drugs that does damage to our society, not the drugs. The drug problem is a public health problem, and we should deal with it in that manner. I hope that answers that part of your question, Elizabeth, and let me go to the next one. What would be 5 insurance plans, or the 5 insurance plans that I have for my health care, and you call them, and of course I was calling them vouchers, healthcare voucher. Would they cover all medical expenses unconditionally, or would they only cover a fixed amount? The answer to your question, they would cover a basic amount of medical expenses for everybody in the United States equally. Now, and when I'm talking about basic, I'm talking about catastrophic, I'm talking about dental, I'm talking about eyeglasses, I'm talking about going to nursing homes, nursing care, all of that. And it would be a basic plan. And I've changed the word from voucher to certificate. A voucher really bothers a lot of people, and so why have people get turned off because they don't like the word? And I do like health care certificates rather than vouchers. It's a fairly complicated plan. Any plan would be. And of course, but the key thing is to understand with respect to health care, there's 3 crises involved. The first one is that there's 50 million people that aren't being covered. The second crisis is the fact that we're going broke as a nation. That's what the fiscal gap is all about, by the runaway cost of Medicare and Medicaid. And then the third crisis is that we saddle the business community with the cost of carrying our healthcare system. The first one, the last one first, and that is, it's ridiculous. Why do we have to turn around and have business enterprise pay for the healthcare system? It makes us uncompetitive in the world. So literally, you're exchanging healthcare for a job. That's not the way to do it. The way I have proposed paying for it and leading it is through a retail sales tax, and we can go into that further. But the second crisis is that we can't continue the health plan that we have with Medicaid and Medicare. I'm on Medicaid, and I've seen some abuses just personally in an operation that I've had. And then, of course, the most important one is, that we're not covering. First and foremost, we have to cover everybody in the United States. Every other industrialized nation except South Africa does do that. And if we think we're so great as a country, that's the least we can do. And then as you go into my health care plan, you'll see that comparing it to others, Hillary and Edwards and Obama are essentially the same. And what they're doing is they're going backwards. They want to heap more on the business to carry the cost of health care, and then they want to pass a law requiring you to go buy a health care plan from an insurance company, which becomes a subsidy for the insurance industry. This is not going to solve the problem and will not address the two critical parts of the crises we face. They only address getting Medicare to all the people, and it will not work. We don't have the money to do it the way they're planning it. Next question you have is about the Fairtax. Well, of course, I was alluding to that when I said that we would pay for our health care, my health care plan. The certificates would be paid for it by a retail sales tax, which would be part of the Fairtax. Now you're asking, how would the Fairtax transform America from a consuming nation to a savings nation? Well, what we have right now is an income tax system that turns around and we think we're getting fair treatment. Well, the average American knows that we're not getting, that our tax system is corrupt and disadvantages them and does nothing for the poor. And so what I'm advocating is that we realize that in theory it sounds good. The more you earn, the more you pay. That's progressive. But it is equally progressive. The more you spend, the more you pay in taxes. So if you don't want to spend a lot in taxes, then what you do is don't spend any money. And that's what will change this nation from a consuming nation to a savings nation, which is what will strengthen our society and permit us to deal with this fiscal gap that I referred to earlier. It also will turn around and we can make it more progressive than it is by simply giving you a rebate for the taxes that you will be paying on a monthly basis on the essentials of life: food, clothing, lodging, transportation, medicine. And so you'll get a rebate of the tax you will be paying for that, because we cannot put forth any exceptions. The minute you have one exception, we'll be back to where we are with the income tax, which is riddled with exceptions, and that's how the wealthy people game the system. This fair tax, in my mind, is the most significant thing we can do before we're even able to address the other issues in our domestic agenda. Another question from Elizabeth is, what else, aside from enacting the fair tax, would you do to help those living in poverty in the United States? And what do you think about John Edwards? And is he sincere about addressing poverty, or is he just using the issue for political gain? I'd give him the benefit of the doubt. It's a little of both. It's a hook for him, and politicians need a hook to operate on. I have a hook. My hook is to empower you with the national initiative. Poverty may be his hook. I think he's sincere about it. I'm sincere about wanting to empower you. I think mine is a lot more important than his will ever be, because in point of fact, with the present tax system that he's prepared to accept, the poor get no advantage from the income tax system, and it's tragically, the poor will get nothing from the Hillary health care system, because the poor have to have income in order to benefit from their system. And under my system, the fair tax will do for the first time in American history. Stop and think. I was defining for you the rebate. Well, if you're poor and you have no job, you get no benefit. Go sleep under a bridge or go on welfare. Under my system, if you're poor, got no job, you will still get the monthly check, a rebate to you for what you would spend if you had the money to spend on these essentials of life. This is the only thing I know in all of American history that would help the poor in this country. Elizabeth, another question from you concerning the prebate. Would you give the monthly prebate or rebate check to all Americans, whether they're rich or poor or what in between? You have to register every year to get the prebate, or a rebate in my case. Well, keep in mind, I don't think Warren Buffett or Bill Gates are going to register to get the prebate. I don't think that most people that are wealthy are going to spend the time to sign up for this, because it would be somewhat embarrassing to them to do this. But we have no control. It's a free country. And if this plan is to work, there'll be transparency, and you'll know what people spend, and you'll know what they pay in taxes. That is what's critical, and that's why we call it a fair tax. And what it will do to this, to rejuvenate this economy, is unbelievable. And so let me see if you've got one last question that I can answer. Elizabeth, no, I did. Fairtax, I've answered. Well, here's a question that you have. It's about, both you and Dennis Kucinich are very progressive candidates. How do you and Dennis Kucinich differ on the issues? We're very much alike on the war issue. We're very much alike on peace and our demands, but we're very different. Dennis is politics as usual, only from the liberal side of the equation, and that's not good enough for me. Politics as usual means that you continue the representative government you have. I've tried to persuade Dennis and educate some of his people about the national initiative, and I supported him in '04. It hasn't done any good at all, and so he's a fine person. I just don't think that he will cut the mustard as President of the United States, because in my view, cutting the mustard is making you a partner in making laws and me being your presidential leader, because you can make Dennis or anybody else you want president, but if you don't empower the people, you're stuck turning to the Congress, and if you haven't figured out that the Congress is not improving your democracy, then you're not entirely well informed. And I think that, Elizabeth, you are informed, because I can tell that by the questions you're asking. Elizabeth, I think I've answered all of your questions. If I haven't, please send in some more, and I'll be happy to deal with them. Thank you very much, Elizabeth. Take care. This is Mike Gravel. Whether you're interested or just curious to know more about me, go to my website, join me, enter your email, send me some questions, learn more about my campaign. Please do it now. Be a part of our ripple effect.